Thank you for the opportunity to just present some pressing nursing issues today and for the opportunity just to speak to you. This I'm doing on behalf of Fundisa, as well as with another head of the SUNC Education Committee on as well. So just to start, I hope that in the next couple of minutes, I will be able to outline the accreditation of postgraduate diplomas in nursing, which was also a topic of discussion previously in this meeting. Just also to talk about the fee structure, the training numbers, the articulation of qualifications, but particularly on the NQF levels, and then also just to tell you about our stakeholder engagement in creating co-solutions for our challenges experienced in nursing thus far. As a point of departure, just a reminder, the mandate of the South African Nursing Council, that it is our statutory body which functions in terms of the Nursing Act number 33 of 2005. For this presentation, I thought it just to highlight the sections that are particularly relevant to this presentation, which is section 4.1.d. And that is just to, again, reiterate that the council are able to conduct inspections and investigations of nursing education institutions at higher education institutions and public and private colleges, nursing programs, and also health establishments in order to ensure compliance with the acts and the rules and standards as determined by the council. Section 4.2.f, they also have the mandate to accredit nursing education institutions, also referred to NEIs, and nursing education programs, and then lastly to carry out quality control inspections in accordance with the prescribed conditions. This is just important to know because if you look at the different fees and the different type of inspections that is done by the council at the various institutions, it's just important to know that inspections and investigations can be done if there is irregularities noted or if the council is concerned about the quality of nursing education. And then also accreditation takes place for new programs, and then focus visits takes place if there is also any query or if there is any audit to be done. And then it's also important that all heads of schools must take note of the regulations related to accreditation of institution as nursing education institutions, which was Government Gazetted number 173 of 8 March 2013. Now, just to give you just the overview of the accredited postgraduate programs in nursing, and this is just for universities across South Africa. And this was from our last SUNC meeting in August, and I do acknowledge SUNC for sharing this information as well. As you can see, the most common programs that has been accredited across the universities are health service management and nursing education, which are actually our non-clinical programs. The rest of the 16 programs on the council's qualifier list is actually clinical programs. And as you can see here, primary healthcare is the most common qualification after the non-clinical programs that has been accredited across the universities. And then we have adult critical care and occupational health and midwifery. What you will also see on this list is that we really don't see a lot of our specialists, rare specializations in terms of child care, child nursing, child critical care nursing, forensic nursing. I'll speak a little bit about that in a minute, infection control, perioperative, and orthopedic nursing. In terms of what the council has been doing in terms of accreditation, evaluation of programs and curricula that is currently in progress and those that are not yet evaluated, it's important just to look at this slide. As you can see, there are lots of programs at the moment in evaluation, and the slide also changed after the August EDCO and the September council meeting. And then also we've got an upcoming meeting next week, so there will be more programs presented. As you can also see that programs that are not evaluated are actually only 3 at this moment, and that also answers the question, because sometimes there's a perception that the accreditation process is delayed by the council. But this is just our latest stats, just to give you a brief overview of what is really happening in terms of the Education Committee and the council processes to accredit nursing programs across the country. I just thought it would be interesting just to show you the provincial distribution of these different universities that are accredited to offer postgraduate programs. And as you can see, there are some provinces that has very little programs. There are some provinces that are that were quite proactive in also being successful in accredited by the council. In terms of the training numbers for those different nursing education institutions, you can see that it is concerning. We've got 3 provinces that no training programs have been accredited at present. And then you can also see the rest of the provinces in terms of training numbers. What is concerning, and this is highlighted and was highlighted in various conversations at Fundisa and at the South African Nursing Council, is that across these provinces that are highlighted, we actually only have accredited numbers to train 2,543 postgraduate students in terms of specialization fields. So we do look at the moment at what are the challenges related to low accredited numbers, and how can we actually assist these other provinces to. So what are the challenges in the accreditation process? And I think this is also quite important for every head of the nursing schools to know about. And I think also for you in your positions to assist in terms of getting these accreditation processes quite smoothly. It's the absence of critical documents, and here that is not dependent on the NEI, but it's a letter of support from the respective provincial departments of health and an annexure allocating the clinical facilities. And I think this is one of the biggest stumble blocks, because often those letters are not signed, it's not dated, it's not stamped, and that also delays the accreditation process. Also, the memorandum of agreement between the NEIs and the respective Department of Health of clinical facilitators. And we actually asked, because this is a requirement in terms of that regulation R174, section 2.2a and 4G. And we really asked the heads of school to ask for assistance in terms of the different provincial departments of health, liaisons and coordinators, to assist them in completing the situation analysis, letters of support and memorandums between the NEIs and the respective DOH departments. The situation analysis, if it's not completed correctly, it does influence the accredited places in terms of clinical facilities that's been appointed. So here again, it will be crucial for the DOH and the NEI to work together. And if you can appoint somebody to actually do that, then it's crucial, because that affects the numbers of students that are allocated to the different programs. Then there's also a delay in resubmitting outstanding documents or amendments to curricula. And this has been addressed by the council to the various NEIs in terms of if they have any challenges, they should rather contact the SANG program evaluator and curriculum evaluators to discuss these challenges in order to fast track the process of having their curriculums actually approved. The second challenge is incomplete documents, and it's not according to the curricular guidelines. What we did last year, beginning of last year, in terms of the council on request of Fundisa as well, is actually to develop a template for curriculum document submission. So if the nursing education institutions and schools actually do adhere to that criteria list, then they will be able to submit their documents and the process would be more smoothly. So all NEIs and heads of departments was received in-service training at one of the Fundisa meetings in order to help them to actually get their curricula approved as soon as possible. One other challenge that really hampers the curriculum accreditation process as well is workload allocation. According to the CHE guidelines, The HR should also be that 50% of academic staff must have the relevant academic qualification than the exit level of the program, meaning that if it is for NQ level 8 and 7, that particular staff member must hold a master's degree. The full-time staff should also have a 2-year plus teaching experience in a recognized higher education institution. They must also have nursing education as one of the other criteria, and they must have the professional experience for the professional program offer and a specialist qualification for the program to be taught as well. And there must be a core full-time permanent staff teaching in the program. We found that at the Education Committee, when we do evaluate curriculums, that this has become quite a challenge because some NEIs do not have the specialists to actually teach in that program. Some must still advertise the post before they can actually get full accreditation for their programs. Some of their staff members are actually in the process of obtaining a master's degree. So we are discussing that with CHE at the moment, and then also see if we can grant provisional or conditional accreditation rather for these programs in order to allow the nursing education institutions to actually continue in their marketing and recruitment of students and getting the internal processes sorted out while we address these human resource challenges with CHE as well. The fourth challenge is actually the CHE accreditation process, and there has been reported from some of the heads of department that they do have a delay in the process. And I think that is where SUNC also, we did sign an MOU with CHE as of last year, and just to talk about these challenges and to see how we can actually filter through it, because in the beginning of the PGDIP qualification submission, it was actually required that SUNC first accredited the program, and then that letter must go to CHE for the CHE submission and review of the curricula. So we are in the process of, I think that process has been smoothened along the way. The fifth challenge that I think a lot of the NEIs is experiencing at the moment is, while they receive accreditation from the council and from CHE, then there's a delay in the SAQA identification numbers that is issued or to be issued. We have an upcoming discussion with DHEAD and regarding that delay, because some of the NEIs reported that they've been waiting for almost as long as 9 months to actually get a SAQA ID in order to progress with the implementation of the curricula at the various NEIs. So that is an upcoming discussion that we will have in council soon, and then map the way forward to assist NEIs with that delay in the SAQA ID numbers. Then I'm just going to go over to the fees. That's also important, because sometimes the heads of department just submit these invoices they receive from the council to your financial departments. But it's important just to understand that every year a board notice is published. For this year's fees, the board notice of 440 of 2023 was published. And in that board notice, all the fees are stipulated. And I think one of the things that are important for NEIs and the HODs to discuss upfront with their financial manager or in the institutions is to budget for these fees. It is the learner enrollment fees, it's accreditation fees. So the accreditation fees, for instance, depends on the number of programs. Like, for instance, if it's 1 or 2 programs that have been submitted for accreditation, it's 16,420, and so it goes up if it's more than 6 programs. It's also important to look at the application for nursing programs or revised curricula. For instance, your PGDIP is 8,210 and the B nursing is I think it's about 10,000. Audit fees, when they do come in visit the NEI for an audit, then there are some fees attached to that as well as the focus visits. And there's also an annual NEI fee that is supposed to be paid by the NEI, which is about 16,420 for this year. Obviously, that will increase for next year. There's also an application fee for clinical facilities and an application fee for the NEI for their respective programs. And I think it's just important for heads of departments to keep this in mind as they go forward in terms of their budgeting as well. I think previously the fees was a concern and a question from this committee. That's why I've just highlighted that. Also in previous discussion, there was a query in terms of training numbers. So I thought I'll just quickly give an overview of that. The training numbers, or the number of accredited students per program, is very much dependent on the situation analysis. So if the situation analysis from the clinical facilities is not completed correctly, then that impacts on the number of students that can be placed in that clinical facilities, and indirectly impacts on the number of students that can be allowed to enroll within the different programs. What is important there is usually to look at the bed occupancy, and that is what the council look at. What is the bed occupancy for instance, emergency nursing or critical care nursing in that particular facility, to accommodate the sufficient learning opportunities and the sufficient learning mentoring that needs to take place within that facility. So again, we had an in-service session about situation analysis, took the HODs through that situation analysis, what is important, what are the main points to look at in order to actually help them so that the numbers for accreditation can be improved. Then it's also dependent on clinical facilities, learning opportunities, and the specialist nurses that is available to teach students and supervise and mentor them while they are in the clinical facilities. And as we know, we do have challenges in our clinical facilities with regards to availability of learning opportunities, the various NEIs that occupies the clinical spaces, and various professions that occupy the spaces, and also human resources and other resources within the clinical facilities. Based on that, the council is at the moment looking at other methodologies in terms of simulation. So we are, as Fundisa, in collaboration with the council, doing a systematic review actually on simulation and what is the percentage that need to be included in a curriculum as part of work integrated learning. And the council is also doing some work around that to see if it will be beneficial for nursing education programs to actually have an increased ratio in simulation, and then less clinical hours on the platform. So that is a work that is in progress. And if all of this is consolidated by Fundisa and by the council, we will look at the different ratios in terms of, because the work integrated at the moment comprises of simulation, clinical practice learning, and role taking within any of these curricula. Then also there is the notion of that our numbers are too low, as I showed in the previous slide, especially across the provinces. So the council has made provision and released a circular in that respect as well, that NEIs can actually request for an increase in training numbers. This year particularly, we received quite extensive requests from various NEIs, but that is also based again on what is available, what are your human resources within the institution, and how is that human resources and the workload distribution within the different programs in the NEI, including your master's and your PhD work distribution as well. But that request has been granted, and NEIs are more than welcome after discussing that, and obviously your enrollment plan with your managers, see if that is something that they want to pursue. Then I just thought I want to also speak about the articulation of qualifications. As you know, when the PG DIPS was introduced, there was quite a bit of wobble in the road in terms of NQF level 7, moving to NQ level 8, which is the PG TIPS diplomas that was pegged on the new NQF level framework. The NQF level 6 was a diploma in nursing. So most of these students in the first year of implementation of PG TIPS could not access the PG TIPS because of the jump in NQF levels from 6 to 8. In the interim period, the CHE has granted us a special concession for students then to be admitted to the PG DIPS with the provision that any eyes have a plan in place, and they must report on that plan on what are the support systems in place that will help these students to success in terms of the gaps that were identified on an NQF level 7. For instance, most of the NEIs took up that concession, and that increased really our enrollment numbers in the second year of implementation of the PGDIPS for most of the NEIs that were accredited. And that really helped in terms of that. However, the NEIs and with their various systems at the universities must still produce a plan of how they did support those students. What we found is that the students needs a lot of support in terms of academic writing and also in terms of digital literacy. And I think in that regard, there's also an opportunity for a lot of the NEIs to develop short learning programs and special support systems for students with that gap. What was also noted in the NQF level articulation was that a lot of students or a lot of potential candidates for the enrollment of the PG TIPS was actually only general nurses and without midwifery. And one of the requirements is that any student that is eligible for the PG TIPS must have a midwifery qualification as well. So there must be a professional nurse and a midwife, or they must have general nursing plus midwifery. That also created another opportunity for developing advanced diplomas on NQF level 7. So the one that has been in collaboration with Fundisa being developed was the advanced diploma in midwifery. However, at this point in time, it is only about 3 colleges that actually presents the advanced diploma in midwifery. No universities has gone that route. We are also looking with Fundisa at the moment and with the National Department of Health of developing other NQF level 7 qualifications. The Advanced Diploma in Mental Health Nursing we've completed the curricula with regards to that, and that was submitted to the National Department of Health. So hopefully, if the council approves all of this, we will have another opportunity to develop, to implement the Advanced Diploma in mental health nursing. And again, the NEIs are encouraged to look at this and use that as another opportunity to actually cross the bridge between the NQF levels and to increase access to the different NEIs. The other NQF levels qualifications that are possibilities, and I think this is an exciting opportunity for NEIs to consider at the different institutions, is also to look at community health nursing. That was one of the other qualification needs that has been highlighted by the National Department of Health. We are also at the moment, Fundisa develop in collaboration with the council core competencies for forensic nursing as well as infection control and prevention qualifications. Those qualifications are supposed to be pegged at NQ level 8 as a PG DIP. At the moment, there are conversations with the National Department of Health in terms of how those nurses, especially forensic nursing, will be absorbed within the workforce and what will be the impact on that in terms of occupational dispensation. So those are exciting opportunities to look at, and I think the heads of department must really just look at all these things and see what is available, what is feasible within their resource capacity to offer, because this is an opportunity that we have probably for the next 5 or 10 years to explore. Then I just want to lastly share that so far, due to all the challenges been experienced, also recognizing that we did not have postgraduate specialist training for almost 3 years after the phasing out in 2019 of these qualifications. Fundisa and SANC, after several meetings and collaboration and stakeholder engagement meetings, we've really come a long way. The council is very supportive of the university training and Fundisa. And what we actually started doing from this year is that with every Fundisa meeting, we actually invite the council based on topics that has been identified by the heads of department, to really engage with them and to answer questions, and to present pertinent issues like, for instance, accreditation issues or registration of students or community service. So those were our very crucial issues and discussions we have, and the relationship definitely did improve. And I must also say, with the new CEO, Prof. Mashali, there has been good communication structures put in place for Fundisa and SANC to regularly meet and collaborate and create co-solutions on how to improve nursing education and training in the country. We also, at those same meetings, have National Department of Health initiatives, and like the forensic nursing is one that I mentioned. But similarly, we invite the National Department of Health to come and share with us what is the challenges within the country, what are the training needs within the country. And I think similarly also, certainly in the Western Cape, we have Provincial Department of Health meetings as well between the different NEIs, just to discuss what is the training needs, what programs do we need, where's the expertise for those programs. For instance, UCT, we decided as body of nursing professionals in the fraternity that UCT would rather take nephrology, while some of us who are very strong in other programs and expertise would rather then choose to offer those programs. So I think those collaborations are very important to, across the sector, look at what are the training needs, what are the supply demand needs, and how do we actually use all our capabilities and expertise across provincial level and national level to actually look at improving specialist training. The capacity building I've touched on, so there we definitely are doing additional workshops from Fundisa's side to assist in curricular education training needs. We also have clinical practice portfolio that also addresses any clinical practice issues and how we can address that, and how we can also find solutions or promote or suggest any recommendations to the council. And then lastly, the CHE and SANC has signed the MOU. It was formally done, and that is also just improve the education and nursing programs in particularly, and to look at how we can strengthen relationships in order to move nursing education forward and to address challenges like, for instance, the NQF level. I think that was a very crucial conversation between CHE, SANC, and other stakeholders to actually promote and to address all these challenges between the nursing education institutions. And I think, colleagues, that's all that I have to say. I'm open for any questions or any suggestions or concerns that you have. Thank you so much.